No one wants to get injured on the job or anywhere for that matter, but when it happens, it's very important to take the right steps to make sure you're well taken care of. Well, joining me this morning to answer some common concerns is board-certified orthopedic surgeon Dr. Daniel Valdez with Sonterra Medical. Doctor, good morning. Welcome to Great TSA.
Thank you.
You know, this is such an important topic to cover because I know the first thing that probably a person thinks about when something like this happens is, how am I going to afford this? You know, what's the first thing we should do?
Yeah, and none of these injuries ever happen when you plan them.
Yeah.
So the first thing you have to do is report it. There's time limits on everything in workers' compensation. You have 30 days to report an injury. At that point, you could lose your rights. Paperwork has to be done within a year, but those first 30 days are the most important.
But why is it those first 30 days? Why is there such a time limit?
The clock starts when you perceive an injury or know or should have known that you were injured. And the reason I say should have known is because sometimes you have exposure to chemicals and you're not sure that you were hurt, but a day or two or a week later you find out and you need to report it because you've got 30 days from the day you found out you were injured.
So what happens if you don't report it or if you're late?
You could lose your rights. It could be that you're not allowed to report it later.
Wow. So when it comes to, let's just say I'm reporting it, what are some common mistakes? What should you put? What should you not put? I mean, what do people do?
Be accurate and be complete. What you'll see in some reports is I slipped and fell. Well, that reports an injury, but not really what happened. If you write something like, I was going into the storeroom to pick up a box of widgets, I slipped on some oil, fell on my left side, hurt my shoulder, my elbow, my hip, and my knee. Now, workers' comp knows what they're covering, and your doctor's going to know what he needs to focus on to treat you.
Okay. Now, speaking of treatment, how do we know which treatment is right? Who do we go with? How do we know what's best for us?
First, you'll find out whether your employer is a subscriber or non-subscriber. Those are the words we use for somebody that follows the Texas rules, that's a subscriber, or somebody who does not follow the Texas state rules. Now, there's other rules they'll follow, but not the Texas state rules. That then determines whether you have a panel, whether you have a group of doctors or a preferred provider, and if you check with them, everything will go much smoother. If you don't have somebody, then you decide based on what your injury is.
Okay, based on what your injury is. Now talk to me about when it's time to come back, you know, recovery process and getting back to work. What are some do's and don'ts?
You have to understand that there's rules about everything in workers' comp, and your doctor has to understand those rules. If he does not, he might not follow them. He might have trouble getting you back to work. There's time limits on how long workers' comp will also last. So if you exceed those time limits, you may not get any further treatment, and if you're not well yet, you may lose your job.
Yeah. So doctor, you've been working through workers' comp for quite some time now. What would you say is the most valuable piece of advice that you could give someone that's going through something like this?
Make sure that your doctor understands what he's doing for you, and make sure that you push him to do it timely. And by timely, I mean, if somebody tells you this is your diagnosis and these are the options, make sure you're working through the options. Don't wait 6 months to get that first therapy. Don't wait 6 months to have that first evaluation or an MRI, whatever is actually needed. Push to get it done now.
Don't wait for someone to tell you, right?
Right.
You say you look for different outlets and who do I need to go to? What do I need to fill out? Okay.
Exactly. And if you're not getting any kind of help or if you're confused, the state provides the Office of the Injured Employee. The Office of the Injured Employee is there to help the injured employee. It's there to help you navigate the system.
Right. I mean, what scared me so much is that you could lose your job over this if you don't do it properly. That's what I thought. Okay, maybe it's going to end up on you and you're going to have to pay for it, but you could lose your job.
Yeah,
so
and it's not a rare thing.
Yeah.
People do lose their jobs.
I appreciate you being with us, Doctor. Thank you so much
for
this
very
helpful
much.
information.
I appreciate it. Thanks.
TSAOG has 7 convenient locations. Their number is 210-804-5400. For more information, you can also visit them online at tsaog.com.